I'm Dr. Paula Termulin, the new Dean of WMed, or maybe not so new. Since joining the medical school in May, I've been meeting with individuals and groups from across the medical school, our affiliates, and the community. What I have learned and heard is that during our first decade, we built an organization that has a solid foundation, and WMed accomplished all of its firsts with great success. Congratulations for all that has been achieved. We can be very proud. During this past fiscal year, we faced the challenges of the pandemic head-on and continued to provide outstanding education to our learners, innovative research, and compassionate care to the communities that we serve. This video highlights just a few of our successes. Let's take a look.
During COVID, while the Sim Center was shut down, we were unable to kind of give that standardized patient education to medical students and really took the opportunity to explore technologies. How can we do this asynchronously? How can they do this at home and still get the learning experiences that they would be getting with real patients or here? And we explored more of a smaller company that we could actually customize material to better integrate into our curriculum.
The AI program is a software that simulates a standardized patient encounter, similar to what they might experience downstairs in the simulation center.
What brings you in today, Deborah?
I came to discuss my finger pain.
We were told that one of our cases was going to be using an artificial intelligence patient instead of just sort of like a PowerPoint slide.
We've tried to make it as real to how we teach students as possible, which is part of that customization. So the student has to ask permission to do the history and physical on the bot. They have to wash their hands before they interact with the chat bot.
It felt more true to life than actually just getting a list of all of the signs and symptoms that someone has. And it kind of ties in different parts of our clinical skills education with our basic science education.
It really gives students a in-the-moment feedback. Yes, your differential diagnosis or what's going through your head and what you're thinking is close or right, or maybe you forgot this, or you didn't ask this particular question.
Technology is kind of important to me, and I like being in a place where I can experiment with kind of pushing the envelope with how we use technology.
AI kind of opens up some interesting possibilities for some unique cases and some unique individuals that they might not see in person here.
I remember in the very beginning how many calls that we would get of sheer panic, of not knowing what to do, and you'd go through all the CDC requirements and okay, this is what you need to do, first this, then that, and then by the end of the phone call, the relief that they were getting, that you could hear. Occupational health and infection control are very closely intertwined. The occupational health side of it is more of the vaccine side of it and the work comp side of it, and the infection control is the PPE and the prevention side of it.
I think occupational health was shouldering a lot of aspects of trying to help people.
Lately we do a lot of COVID tests, vaccine tracking for COVID, mask fit testing, PPE distribution. One of the big things we did and we've spent a lot of time doing is coordinating the vaccines with the county. First it was testing and then it was vaccines, and when they did the major rollout at the Expo Center, they couldn't do that alone. So they turned to us.
So we had everybody from faculty MDs coming to our office down to students, new students learning how to give an immunization. And then clinical staff all joined in as well.
From February through early June 2021, WMed volunteers staff 544 shifts at 47 clinics for a total of 2,100 hours.
They went beyond what their job description was to really help as many people as they could at that time.
Our job is to help people be safe and feel safe and know that we're doing everything we can for them.
So proud to watch everyone step out of their comfort zone to take care of not only each other, but to take care of our patients in an altruistic way. Just a sincere thank you from the bottom of my heart and from the rest of the team in clinical affairs.
The virtual data warehouse is our capability here at WMed. It's something that we just started where we want to have the ability to get data from multiple other databases and combine them together so we can provide more robust data sets for our faculty, residents, and medical students to use for their research or quality improvement projects.
An investigator or a faculty member comes to us and has a project, they will specify the questions they want to have answered. We'll work with them and say, like, do those data exist? Are they in the right form?
Some of the new guidelines that have come out have said that patients with a certain BMI and with blood pressure issues have a higher likelihood of sleep apnea. And one of our residents was curious about how often this was actually happening, that these people that met these risk criteria were actually getting the screenings that they were supposed to. And so that was something that we ran with the data warehouse and pulled back the information, and we found that it was significantly low how many patients it looked like were actually getting screened for sleep apnea. From that, we actually set up a care gap within our electronic health record so that when patients meet those risk factors, it gets flagged. It will alert the physician this patient should be screened for this. So hopefully that ups the number of patients that are getting the screening that they need.
That was a great example of how we could use the data to just sort of derive secondary value from our data and then implement a solution.
So when we have the ability to pull large amounts of data and compare different things, that's when you can really see what's actually going on. And that's something that we can really help with the virtual data warehouse.
And what I'm involved in is connecting the school with community partners. And so partnership with the organizations, of course, with COVID, was diminished. A lot of community organizations were closed. We only had a few opportunities that were virtual. But students still were able to connect with the organizations that we did have to do virtual kind of projects to kind of help the organizations during that time to continue to serve the clients that they serve. And it also saw an opportunity for students to really get out there where it counted when we got the vaccine, and also for COVID information. So our students really were ready to actually get into action to be able to help make a difference. So we had multiple pop-up clinics. Students developed kind of like the list, the sign-ups, the volunteers. They were actually on volunteer sites to give information. They were on volunteer pop-up clinics to actually give the vaccines. They were doing all that they could. It helped them to really see how community organizations can come together and collaborate and how they could actually be part of that. For example, the Gospel Mission, where we're doing health screenings. We're building on that. We've actually built on the types of screenings we're doing, as well as expanding our services. They are tutoring kids that need to be tutored. We have the Homeless Mission. They are in the Homeless Mission doing screenings. They are in the Homeless Mission serving food. They are actually in the Kalamazoo Literacy Council doing Literacy Council fairs that talk about literacy and how important that is. And we have third year and fourth year students that are helping with street medicine. So throughout Kalamazoo, particularly in areas where most need it, our students were there. So proud of them.
The purpose of our economic stewardship strategy is to ensure fiscal and operational effectiveness. One way we support this is through our annual budget, which include revenue and expense monitoring. In the last fiscal year budget that ended June 30th, we were below our revenue projections by about $1.6 million, but we were under budget for our total expenses by $8.1 million. This was due to open positions and less than expected operating expenses during the pandemic. We ended the year with a $6.5 million positive net budget variance. This means we spent $6.5 million less than we planned, and therefore we did not need to withdraw those funds from our endowment or from our hospital funding partners. Another exciting announcement last year related to the long-term sustainability of the medical school. On June 8th, it was publicly announced that WMed would be the recipient of the Empowering Futures Gift, a $300 million pledge to advance the mission of the medical school. The gift is focused on the future by establishing new scholarships, creating and implementing new diversity, equity, inclusion, and social justice programs, enhancing research initiatives, and ensuring the financial sustainability of the medical school. The funds will not be used to enhance the usual annual budgetary items such as employee pay increases, employee travel, general supplies, and equipment. The $300 million will be contributed to the medical school endowment in increments of $30 million per year for 10 years, starting with the first payment in December of 2021. A portion of these funds will be used to establish a permanent endowment for ongoing support of medical school operations. Another portion of the funds will support new initiatives that allow for the long-term advancement of the medical school. In 2020, we set out to answer an important question. What economic impacts has the medical school had on the region? To do so, we engaged the Regional and Economic Planning Services team at the W.E. Upjohn Institute for Employment Research. The team collected data from the medical school and surveyed medical students. That data was the foundation of a report from the Upjohn Institute that shows the economic impacts of WMed are immense. The report highlighted that overall spending by WMed and its 337 students in 2020 added 1,600 new jobs, provided an additional $115 million in personal income, and fueled a $353 million increase in output or total sales in Kalamazoo and Calhoun counties. The team from the Upjohn Institute also said that, holding all things constant, the estimated impact of the medical school in 2020 is likely to be repeated in future years.
I'm with Dr. Karen Hornifer-Ginter, our Associate Dean for Culture and Wellness, to talk about the medical school culture, how it has been impacted by the pandemic, and more importantly, how WMed responded. I congratulate everyone at WMed for finding new and creative ways so that we could continue our operations. While the delivery was different, you never stopped the learning, the training, the patient care, and the work. Karen, can you tell me more about what changed and how the medical school adapted?
Yeah, well, boy, the pandemic really necessitated a divided response from WMed in that our clinical operations, our facilities operations continued in person, really uninterrupted. And then so many of us outside of that were really questioning, can we move our work remotely? Mm-hmm. You know, and we soon realized, in large part thanks to our IT department, that actually we could. And came to see some advantages to being able to work remotely. It's interesting, when I think back to that time, I feel like it really required such an enormous amount of dedication, resiliency, flexibility among all of us at WMed. There was quite a all hands on deck, almost a heroic coming together. And I think in large part that contributed to actually increasing our levels of engagement at WMed.
You know, I saw that when I arrived, and it's been reflected on our 2021 WMed Employee Engagement Survey. The results are something you should all be very proud of. Overall, the institution saw significant growth, more than 4 percentage points compared to 2 years ago, in the Engagement Indicator Score, which is a composite metric that includes employees' degree of pride in their employer, their intent to stay, their willingness to recommend their employer to friends and family for care, and their overall satisfaction with their workplace.
And that really was encouraging for all of the efforts that various leaders and departments were making to help people feel engaged. To see that increase for WMed was really notable because a lot of comparable organizations over that time actually saw decreases in their levels of engagement.
Well, what are some of the other cultural and wellness initiatives that we have at WMed?
Yeah, I'll first say the intention with those initiatives for culture and wellness is to really help people feel supported, to help people feel connected with each other and with WMed, and to try to encourage all of us to continue growing and learning, not only our students and residents. One of the initiatives I've really appreciated has come from our Office of Health Equity and Community Affairs and Diversity and Inclusiveness. They have hosted a series of courageous conversations with voices from our student leaders, from our community members, really encouraging all of us to improve our work and to think about how professionally and personally we can help eliminate health disparities, racial inequities, racial injustices. That has been so meaningful. We also have launched some psychological safety programming just to ensure that people at WMed feel included, that they feel that they can speak up if they're concerned about something. It's amazing when I look at the calendar and I see so many offerings from our clinical departments, faculty affairs, organizational development. There's so much happening. Now that we're finally able to be back in person, we're trying to take advantage of some of these opportunities. I'm struck by with wellness, it's not only about supporting people's mental health and the more serious educational offerings, but also bringing some lightness and joy to our work, just knowing how demanding and intense it is. And so we're excited to bring back our beloved therapy dogs, to start to bring back...
Did you just say dogs? I love therapy dogs. We're going to have so much fun with that. What else is going on?
We have some salad. Actually, they used to be salad bars, and for the time being, we'll be bringing back prepackaged salads.
Karen, I can't tell you how wonderful it is to hear about all of these different initiatives. It's also, WMed is so fortunate to have such an emphasis on culture and wellness. We have more work to do, and yet we have ways that we both can dig in and do the hard work. But I really appreciated that you mentioned the joy that we need to bring to our work and to find. So thank you, Karen, for joining me today to talk about the culture at WMed. This great work and all that has been accomplished during the pandemic is truly inspiring. Our commitment to excellence positions WMed for a bright future to become a leader among medical schools across the country. Every organization needs to determine its path forward. It's important for us to understand where we are headed and what we will want to accomplish in the next decade. Creating an aspirational and inspiring vision will help us clearly define our identity and to build an even stronger culture. Now is the time. Our current strategic plan was developed to end by June 30, 2022. This fall, we launched our Empowering Our Future Strategic Planning Initiative, which is a 3-phased process involving discovery, shaping the vision, and translating the vision into action. Everyone at WMed will have an opportunity to touch this process in some way. Could be a meeting, focus group, or an online survey. I want to ask you to commit to be a part of this process because it is absolutely vital for our future. We need you to help us determine the trajectory and identity of WMed going forward. Thank you for all that you do to make WMed a great place to learn and work. I am honored to be here as we plan the future of WMed together.